Donna, this is Ashley Godoyne. I am here to do the NG insertion, irrigation, and discontinue. For the sake of the video today, I do not have any pH testing strips, but they would be located right over here, along with the bottle to know the pH intensity. We also would have some cloth for the patient in case emesis basin, and some Kleenexes in case anything were to leak out. And I also have my NG tubing here. So I would come in, do the regular assessment of the patient, make sure that everything's okay, probably listen for some bowel sounds. That's probably the reason why the patient is getting an NG tube. You also want to explain to the patient what's going on. I have my tubing here along with my anti-reflux valve connected to the blue to blue there. So when I assess and explain, for the assessment of the patient, I need to make sure which nostril is going to be the best nostril for us to do surgery in. I would ask the patient, whether or not they've had any surgeries, if they've, prefer one side or the other, maybe they have a bad cold, one nostril's been blocked, whatever the situation may be. Just figure out which will be best for you. So then you want to measure where your NG tube, how far it'll go down. So you're going to measure from the nose to the back of the ear, and then from the back of the ear to the xiphoid process. So then I'm going to put some tape right here. Then I'm going to coil the end of my tubing just so that it goes with the natural flow of the body there. So I'm going to wrap it up around my fingers a little bit. Also, for the sake of the video, I would have a cup of water with a straw because it's really good when you're inserting the tube to make sure that the patient can keep drinking and swallowing. So I moved the first 4 inches of my tube, first 3 to 4 inches there. I would also have my tube ready from the wall, so I have my air suction. And your big syringe to check, make sure you have correct placement. Also, for the sake of the video, I have this cup of water. Normally, you would put this normal saline into a regular glass of water. So then I'm going to insert the tubing here for the first 4 inches. For the sake of the video validation, I will not be able to go all the way down to the tape because of the mannequin. But at this point, the patient may be gagging. If the patient is gagging, you want to pull back a little bit, but just have them keep swallowing. And at this point, you would give them some water. Swallow, keep swallowing, and then once you do the insertion, you're going to do hand over hand. Down. All the way up to the tape here. So I still haven't gotten all the way up to my tape, but for the sake of the video, you would keep going. Then you want to never, ever, ever let go of your tubing here. I have a piece of tape that is ripped down the middle, so I want to make sure that that's held in place. I'll just wrap one piece around it so that the tube stays in place. So then I'm going to pump 5 to 10 cc's of air into my tubing. And then I'm also going to aspirate a little bit. I want to make sure that you keep that tubing clamped once it's down there. Then I would bring it over. Say my pH testing strips are right here. I would test my pH. Make sure if you have a pH from 0 to 4, then you would make sure that anywhere a pH from 0 to 4, you know that it is in the correct placement. So then once I know that it's in the correct placement, I will secure the rest of the tape. And then I'm going to secure it right down here to the patient so that he has free okay way to move his head, and he still has some leeway there. You also want to check, maybe with a pen light, make sure the patient is comfortable. It's good to look in the back of the throat and make sure that there is no curling of the tube. Make sure that the tube went down correctly. Then you want to hook up your suction tube to the wall. And you're going to remove your tubing here. Once you turn on your suction, you always need to pump some air into the tubing. This will be the only time that air goes into the blue tubing. You want to get that suction off the side of the wall of the stomach lining. So then I'm just going to make sure that that's in there. Reconnect my anti-reflux valve. And the patient's good to go. You want to make sure they're so comfortable, you're good to go. Then you come in a little bit later and you are going to irrigate the NG tube. So there you want to do a full check. Another thing to make sure that I forgot to mention a second ago, another thing good to make sure that every time you pump air into the stomach, you need to be listening. And that first time you need to be listening right to the left of the xiphoid process. And then after that, you're going to listen in all 4 quadrants. But when you're pumping in air, it needs to be up there. So then we're going to do the irrigation. So then I would do the all 4 again, check all 4 quadrants. Then I would go back again, do the pH test just to check for placement, make sure that it's still accurately placed in the stomach. How you do that, you just aspirate a little bit and put it on your pH cloth over here. Then we would our suction over here. Then we're going to push 5 to 10 cc's of air to disconnect our suction while we're listening to the fundus. So say I'm not hearing anything and there is a lodge. So for a lodge, what we need to do, make sure that our tubing is clamped here momentarily. Then we're going to come over and grab 30 cc's of water, or excuse me, 10 cc's of water, and then 10 cc's of air. You want to have about 30 cc's of tap water on hand, but then you're just going to keep pumping that through here. Actually, what we're going to do with, to make sure that there is not a lodge in the pump, when you do half air and half water, that's actually when you're going to discontinue. Sorry about that. So what it's going to be for when you're checking for the dislodge is just 30 cc's of plain tap water per your facility's request. So I guess if your facility wants you to use normal saline or whatever that case may be, then that's what it'll be. But you want to make sure that you're still listening there. You're going to pump back and forth really fast to try to dislodge that. Finally, when it goes through, you're going to hear it, you're going to feel and you're going to hear it. So then I'm going to disconnect my syringe here. And reconnect it to my suction. And then anytime you turn the suction on, you always need to pump 5 to 10 cc's of air to get that suction off of the wall of the And then the patient is good to go again once they're connected to that, and you always have that anti-reflux valve. So then, once you're completed with that, the doctor tells you a couple days later that you need to discontinue the NG tube. Then we're going to listen to all 4 quadrants. In order to remove an NG, you need to make sure that all of the quadrants have active vowel sounds. So you want to make sure that all of that is in place. In case anything were to happen, we always want our Kleenexes available for insertion and removal. So then we are going to shut off our air here. Every time you use this syringe, you're going to want to get a new one. So then while you're pumping about 10 cc's through, you want to listen for that swish again. Alright, so I heard that swish, and I'm also going to aspirate. Once again, we're checking for the correct pH. 0 to 4 means in the stomach. So if it's in the stomach, then we are good to continue on with our removal. Then I'm going to clamp this again to make sure that the patient stays, that we're not going to have anything leaking out of there. So for a removal, we need 40 cc's total. First, we're going to get 10 of water, and then 10 of air. I'm going to disconnect our tubing here. And we are going to hold it in an upright position so the water goes through the tube first. First, we're going to do the first 20 of water and then the last 20 of air to clean out the aspirations from the tube with the water, and then we're going to clean out the water with the air. Then we're going to leave that tube connected while we remove all of our tape. And for the removal, we want the patient to take a deep breath, and it's once again the hand over hand. Anytime you don't have tape connected, we always need to keep a hand on this tube. So we're going to do the hand over hand removal again, having the patient always take a deep breath. We're going to make sure that the patient's okay, clean the patient up. Also want to make sure that your tubing is intact all the time. Anything that goes into the body must come out looking the same way. Anytime you do an NG removal or insertion, the oral cares are very, very important. So you always want to remember to have your oral cares completed after that's done. Ensure the patient's comfortable, make sure that they don't have any pain. Then you're going to do all your documentation, and you just always want to ensure that your patient's comfortable. Anytime you put your suction tube on, you always have to aspirate with air, and that's just a good point to remember every time you do an NG tube. Thank you, Donna, and hope you have a great day.